Welcome today. We're diving into a common yet often overlooked kidney injury, renal contusion, or kidney bruising. This occurs when the kidney sustains blunt force trauma, resulting in damage to its tissues and blood vessels. We'll explore the causes, symptoms, diagnosis, treatment, and more, providing you with a comprehensive understanding of this condition. So, what causes a renal contusion? The primary culprit is blunt force trauma to the abdomen or flank. This can happen in various scenarios, including motor vehicle accidents, falls, sports injuries, or direct assaults. High-impact collisions or falls are particularly dangerous, as they can transmit significant force to the kidneys, leading to bruising. Less common causes can include certain medical procedures or even violent coughing, though these are rare. Let's delve into the pathophysiology. When the kidney experiences blunt force trauma, the delicate blood vessels and renal parenchyma, the functional tissue of the kidney, become damaged. This damage leads to hemorrhage, or bleeding, within the kidney. The blood accumulates, forming a hematoma, which is a collection of blood outside of the blood vessels. This hematoma can be within the kidney itself, intrarenal, or surrounding its perirenal. The extent of the damage and the size of the hematoma determine the severity of the contusion. In severe cases, the renal capsule, the tough outer layer of the kidney, can also be torn. Renal contusions are relatively common, especially in the context of trauma. They are seen more frequently in males, likely due to their higher participation in activities with a higher risk of traumatic injury, such as contact sports and certain occupations. The incidence peaks in young adults due to their higher rates of risk-taking behaviors and accidental injuries. However, renal contusions can occur in individuals of any age who experience blunt abdominal trauma. Recognizing the signs and symptoms of a renal contusion is crucial. The most common symptom is flank pain, which is pain in the side of your back, where the kidneys are located. This pain can range from mild to severe. Another telltale sign is hematuria, which is blood in the urine. The urine may appear pink, red, or even brown. Other symptoms can include abdominal tenderness, nausea, vomiting, and in severe cases, signs of shock, such as rapid heart rate, low blood pressure, and dizziness. It's important to seek medical attention immediately if you suspect a renal contusion. Diagnosing a renal contusion typically involves a combination of physical examination and imaging studies. A doctor will assess your symptoms and perform a physical exam to check for tenderness and signs of trauma. The gold standard for diagnosis is a CT scan with contrast. This imaging technique provides detailed images of the kidneys and surrounding structures, allowing doctors to visualize the extent of the contusion, the presence of hematomas, and any other associated injuries. Urinalysis is also performed to detect the presence of blood in the urine. In some cases, ultrasound may be used as an initial screening tool, especially in children. Renal contusions can be classified based on the severity of the injury. Although not a formal classification, they can be broadly categorized as mild, moderate, or severe. Mild contusions involve minimal damage to the renal parenchyma with a small hematoma. Moderate contusions involve more significant damage and a larger hematoma. Severe contusions involve extensive parenchymal damage, large hematomas, and potential tearing of the renal capsule or collecting system. More formal grading systems exist, like the American Association for the Surgery of Trauma ASD organ injury scale, which range from grade I minor to grade V, a shattered kidney. The treatment for a renal contusion depends on the severity of the injury. Most minor to moderate contusions can be managed conservatively with rest, pain medication, and close monitoring. Patients are typically advised to restrict their activity and avoid strenuous exercise until the kidney has healed. Pain medication helps manage the discomfort. Serial blood tests and urine tests are performed to monitor kidney function and check for persistent bleeding. In severe cases, surgical intervention may be necessary. This may involve repairing lacerations, draining large hematomas, or in the most extreme situations, removing the kidney and nephrectomy. Blood transfusions may be needed to address blood loss. Preventing renal contusions primarily involves minimizing the risk of blunt abdominal trauma. This includes wearing seat belts while driving, taking precautions to prevent falls, and using appropriate protective equipment during sports activities. Promoting safe driving habits and advocating for safer working conditions can also help reduce the incidence of renal contusions. The prognosis for renal contusions is generally good, especially for mild to moderate injuries. Most patients recover fully with conservative management. However, severe contusions can lead to complications such as chronic kidney disease, hypertension, or the need for long-term dialysis in rare cases. Recent research focuses on improving imaging techniques for earlier and more accurate diagnosis, as well as developing less invasive surgical approaches for managing severe injuries. Studies are also exploring the potential role of regenerative medicine in promoting kidney healing after trauma. Continued research promises to further improve the outcomes for patients with renal contusions.